Hi, my name is Steve Stark, and I have severe underarm sweating.
My name is Dominique Barra, and I have severe underarm sweating.
My name is Tiffany Taylor, and I have severe underarm sweating.
Severe underarm sweating is a condition that affects many people, and many of them will resort to using topical agents that may not effectively treat their condition. Hi, my name is Janelle Goddard, and I'm here to tell you about Botox, botulinum toxin type A, a treatment your doctor has prescribed or is considering prescribing for you. During this video, you'll learn about some of the benefits of Botox treatment from a noted physician, and you'll see how Botox is administered. But first, let's hear from some people with severe underarm sweating.
Always carry deodorant in my purse, and then I'd carry an extra shirt in my car so that in case something did happen, I could change my shirt.
I would do things that others would consider ridiculous. I would stuff paper towels or napkins in my armpits, under my shirt.
I noticed that I was sweating a lot, and I didn't know why. It often made me appear to be nervous when I really wasn't.
You know, I couldn't wear certain colors because, you know, the sweat would show through a lot easier, and certain style shirts would, you know, make it worse.
There were moments where I had paper towels falling down the sleeve of my shirt and would end up in the cuff of my shirt.
Severe underarm sweating is what doctors call severe primary axillary hyperhidrosis. Fortunately, for many people, Botox treatment may provide relief from this condition when topical agents such as antiperspirants and deodorants don't work. In these cases, Botox treatment may be the next step. You should know that Botox, botulinum toxin type A, is approved by the Food and Drug Administration for the treatment of primary axillary hyperhidrosis that is inadequately managed with topical agents. Botox treatment is not a cream or a powder, but rather it is an effective prescription medicine that is injected into the skin to help reduce or stop your sweat glands from producing severe amounts of sweat. Botox is a prescription treatment that takes place in a doctor's office. The entire procedure takes about 30 to 45 minutes. Dr. Deanna Glazer, a noted dermatologist in St. Louis, has been using Botox to treat many of her patients who have severe underarm sweating that is inadequately managed with topical agents.
I usually recommend Botox for the treatment of their hyperhidrosis if they've failed other medical treatment, and I like to use it because I know that I can get very good results that are long lasting, and it just has such a high patient satisfaction. I can treat the patients once, they'll get a long duration of benefit, so patients like it. They're not having to manage their own disease on a daily basis, and there are few side effects. Patient satisfaction is extremely high with Botox.
Before undergoing Botox treatment, here's how you should prepare. Shave your underarms and don't use over-the-counter deodorants or antiperspirants for 24 hours before your appointment. About 30 minutes before you arrive at the doctor's office, rest comfortably and avoid exercise and hot drinks.
I went into my dermatologist's office for the treatment. They put iodine under my arms. Whatever the area turned black, that's where I would sweat the most from.
Botox, botulinum toxin type A treatment, controls severe underarm sweating by blocking the chemical signals from nerves that stimulate the sweat glands. When the sweat glands don't receive chemical signals, the severe sweating stops.
In my own clinical practice, it's not uncommon for my patients to get at least 6 months of benefit when I treat their axillary hyperhidrosis with Botox. In studies, at least 80% of patients show an excellent response, and patients are incredibly satisfied with the treatment.
I went into the office, I'd scheduled an appointment, and they do a mapping of where your sweat glands are located that seem to be producing excess sweat. And they map it, they inject the Botox, and you're done.
On a scale from 1 to 10, 10 being the greatest pain I've ever felt, I'd give it a 2. I mean, it really didn't even hurt.
And we know that when we give it to patients, it has a very localized effect. It will stop their sweating in the area that we've administered it, and they can have a very long benefit from the drug.
Botox is an effective treatment for the control of severe underarm sweating that is inadequately managed with topical agents.
I went from deodorant to deodorant to deodorant to try and find one that would help me, and nothing worked.
I would have never thought in a million years that it would work, but now that I know that it does work and it's proven, because I'm walking proof that it does work, it's great.
And then as the days progressed, I was just like, whoa, this is great.
Botox does stand for a very simple procedure that is relatively pain-free. Very simple, very quick. It's a matter of minutes, and you're done.
There are potential side effects with Botox treatment that you should know about. Important safety information. Botox treatment is contraindicated in the presence of infection at the proposed injection sites and in individuals with known hypersensitivity to any ingredient in the formulation. Patients with neuromuscular junctional disorders such as myasthenia gravis or Lambert-Eaton syndrome should only receive Botox treatment with caution. Patients with neuromuscular disorders may be at increased risk of clinically significant systemic effects, including difficulty swallowing and breathing difficulties with typical doses of Botox. The most frequently reported side effects, 3% to 10% of patients, following Botox injection were injection site pain and bleeding, non-underarm sweating, infection, inflammation of the throat, flu syndrome, headache, fever, neck or back pain, itching, and anxiety. Don't hesitate to ask your doctor if you have any questions or concerns about your current medical condition or about the Botox procedure itself. I'm pleased that we could share a few moments together today. We hope we've helped you understand more about Botox therapy, including what to expect during a procedure. Thank you for your time, and remember, always ask your doctor if you have any questions.